Breakfast, exercise, and an outing with lunch are all part of Day on the Go, a well-received program of the Council on Aging of West Florida's Adult Day Healthcare Center. Joining me to share information on the program is Center Director Sandie Holtry. Sandie, thank you for being here.
Thank you, Jeff.
Well, you've always got all kinds of things going on how you do all that you do, and then Day on the Go on top of the other activities at the center. But this is a program of the center. Tell us a little bit about what Adult Day Healthcare is and what you do at the center on a daily basis.
Okay. Adult Day Healthcare, Jeff, is a safe, secure environment for those over the age of 60 who have physical impairments and cognitive impairments such as Alzheimer's and dementia. We have a daily structured schedule of therapeutic activities. We play games, bingo, we go on field trips, we play sports games, we reminisce, we socialize, we do mental stimulation of spelling and math, fill in the blanks, states and capitals. We have a hot breakfast, hot lunch, and a snack in the afternoon. It's a great place for seniors to interact, to socialize, and just to have a productive life.
For those who may not be familiar with the concept of Adult Day Healthcare, is this an overnight thing? Tell us about your hours and how this might work into someone's life, if you don't mind.
We're open Monday through Friday from 7:30 a.m. to 5:30 p.m. So no, it is just that, an adult daycare during the day hours. We're giving caregivers respite, relief if they're still in the workforce, if they're still volunteering in the community, have obligations, so they can drop off their loved one. We keep them busy, they're safe, secure, while the caregiver has their time.
And we do talk about this as being Adult Day Health Care. Tell us about the health component, about the staff and the training that they receive. So this is not just a place for people to go and spend time. They're actually being looked at, and the medication. Talk about that if you don't mind.
We have 2 LPNs on staff and myself. I'm a registered nurse. The nurses are able to administer medications, administer treatments. We do a lot of physical assessments. We can pick up on changes in the client's conditions, notify families, set up doctor's appointments, arrange for physical therapy, occupational therapy if we see that's needed. So yes, there is a great medical aspect, which seniors are so frail, their conditions change so quickly. So it's great that we have nurses and we can assess that.
Right, and have those eyes on them all day long. Well, so Day on the Go kind of takes it a step further, or tell us a little bit about well, first, what is Day on the Go?
Day on the Go is a program for higher functioning clients who are still very active. They want to remain active in the community. They still have interests, hobbies, and again, they like to socialize. They like to stay on the go, stay busy. Caregivers, however, it's a challenge. With their busy schedule, they might not have a day to take off to take the client to a museum in Mobile for the day or to Gulf Breeze Zoo for the day. So that's where we come in. The caregiver can go to work, fulfill their obligations, and we can take the client on all those field trips for Day on the Go.
So these outings, like you say, to Mobile, Gulf Breeze, you go to the Gulfarium, it is a nice outing. Is this the same group of participants that attend Adult Day Health Care on a regular basis, or is this a different, you use the term higher functioning. Please explain that a little bit more.
At our Adult Day Health Care Center, we do have Alzheimer and dementia type clients. We care for clients from early stages of Alzheimer's to later stages. The early stages of Alzheimer's and dementia would be the higher functioning clients. They require minimal supervision. They can still converse, they can still make decisions. When we go to museums, they're able to ask questions, they interact, they're interested in what we're seeing. They can order their food off the menu. Whereas at daycare, when we have the end stage dementia, where we're total caring for them. We toilet them, we feed them, they need assistance with ambulation, so that's the difference. But the clients can attend both daycare and Day on the Go programs. They do enjoy just our daily daycare calendar, so they do enjoy both programs. But we do have a few clients who just do attend the Day on the Go, the higher functioning outings.
Okay, so yeah, it might be a way, maybe someone doesn't feel that a Monday through Friday situation is what they need right now, but they do need, like you say, caregiver needs some breaks, and it's a great thing. And then they've already become familiar with you, your staff, and the center, and as their needs progress, maybe that will be an easier transition. What about support for these higher functioning people in terms of support for their families? Is this something new? Is this something unique to our community that you're doing?
Yes, it is. Day on the Go has been operating almost 2 years now. Again, we started that because we saw the higher functioning clients attending daycare, and we just didn't have that level of activity to keep them happy that they required. So we started the Day on the Go, and yes, we are a unique program. Let me say that our daycare center is also unique in that we're the only licensed daycare facility in our area, and we're licensed to care for 52 clients a day.
Oh, that's great, and our community is very lucky to have you and your staff and the facility. Well, I know you got a trip coming up. Let's talk about that. Where are you going?
Our next Day on the Go trip is Friday, February the 25th. We're going to visit the Baker Block Museum in Jay. We'll stop along the way for lunch at a restaurant. In March coming up is the Rave Theater and lunch at McDonald's. We'll visit the NAS Aviation Museum and have lunch at the Kubi Cafe. In April will be the Bellingrath Gardens trip. That is a big trip. Everyone wants to go see the azaleas bloom. That date will be announced. We kind of watch to see when the best time to see the flowers. Right. Springtime is great with the warmer weather. We'll be visiting the zoo, yes, the Golfarium, Bellingrath, lots of parks, picnic areas. It's a wonderful time of year.
Well, what kind of feedback do you get from the people who go, and as well as their family members?
The clients just love it. They talk all day, they interact, they remember where they've been, they go home and tell their family member what they've seen, where they've been. They like to pick up maps and any kind of information, brochures where we visit. It's very stimulating. They don't nap during the day, they're not sleeping, so therefore they rest better in the evening for the caregivers.
Great. Well, we've talked a little bit about what's included. Remind everybody what's included and then the price of the outing.
The price is $65 a day. To be enrolled, there is a simple form that the physician has to complete, lists medications, allergies, diet, and a recent chest x-ray result or TB skin test. The state is interested. We're interested in free of communicable disease. Again, we have breakfast, lunch, and it pays for the admission fee wherever we visit.
Okay, so those eligibility criteria with the x-rays and stuff, that's the same whether it's a regular daycare participant or a Day on the Go person?
Yes,
okay,
same form.
So it's the same information, but then they also would include the outing as well. So if somebody wants more information and they want to talk to you about Day on the Go, or maybe they want to come and tour the Adult Day Healthcare Center, what should they do?
We welcome people to come tour. We're located at 875 Royce Street, again, Monday through Friday, 7:30 to 5:30. You can drop in anytime if you're in the area. The two nurses will be happy to tour you. If I'm there, I'll be happy to tour you. Or you can call 850-432-1475, and I'll be happy to set up a time where you can come look, and we'd love to take care of your loved one.
And they do need to also call to make a reservation for Day on the Go as well.
Most
correct?
Definitely. We have limited seating, and yes, there are a lot of participants.
Great. Well, you just are always doing really good things and taking very good care of a lot of people. So thank you very much for all you do.
Thank you, Jeff.